This is a steady bleeding of the funds. The management itself now has grown from being 3 or 4% of the overall budget of the NHS to around 20%. The PFI is an ever increasing segment of the funding of the institution. And therefore, you'd see, despite the apparently large figures which go into the health, over 140 billion pounds a year, that we see relative, an absolute underfunding, under-resourcing, diminution in the number of beds, so a reduction in overall capacity, reduction in staff, reduction in frontline services, and increasingly, and driven home by the pandemic, we're finding it harder as individuals to access NHS care, to access a GP, to actually get examined by a professional. Why is it, we kind of understood for a period of time that there was a risk of face-to-face contact, and it might be necessary to defer some level of care. We built such an enormous waiting list, even prior to the pandemic, but accentuated by the pandemic. And now we are in the middle of a process whereby many of these telephone consultations, video consultations, will be made a permanent feature of working, which will further diminish access to care. And by diminishing access to care, those who can afford it will be encouraged to have insurance to get around these larger and larger waiting lists. And in this way, we'll gradually all be forced into taking out insurance.